Hey there, Dr. Jill Wener here again. This is part 2 of the 7-day Corona Emotional Survival Kit for healthcare professionals. Thank you for doing all the work you do. As a disclaimer, this is not medical advice. If you are feeling extraordinarily stressed, suicidal, having panic attacks, please do seek the care of a healthcare professional, a mental health care professional. And make sure you are getting support from your loved ones and taking care of yourself. I'm so grateful for all the work you are doing as a healthcare professional in this really, really unprecedented time. So today's video is going to be about anxiety and panic, fear and worry about health, the health of yourself or the health of loved ones. I'm going to read to you some of the statements that I heard from the women that I researched, that I interviewed. What some other people are feeling out there. So you may relate to some of these. Several people had chronic illnesses on their own. So there's fear that the virus will kill them as an immunocompromised physician. Panic as a single parent working in healthcare, not knowing how I'm going to take care of my daughter if I get sick. Concern for my parents or in-laws. Fear for my family who may live overseas. Scared for my husband who's a hospitalist and myself being pregnant. And having increased risk possibly, and also wondering what the hospital is going to be like when it's time for me to deliver. Fear for myself as I have congenital heart defects and how that's going to increase my risks. Fear just in general, like I'm waiting on bated breath for doom to come. I'm scared for myself, my patients, my kids, my husband, who's an ICU doctor. I'm afraid I'm going to catch the virus. I feel vulnerable for the first time in my life. I know the chances of getting infected will be high, and I know I'll be fine, but what if I'm not? Fear for elderly patients for going out in public, and also her insistence on not going to visit them in order to protect them. Fear for elderly parents and in-laws, but also for friends from med school and residency who are at high risk of getting ill. So maybe you're not right now working in the higher risk healthcare areas, but your colleagues and your friends are at much higher risk. I'm terrified that I'm going to infect my family. I have an asthmatic husband who is my stay-at-home childcare provider now homeschool teacher. So we're making sure that their family members are safe. Fear that my in-laws and parents are older and I don't want to give it to them. So not just being afraid that they're going to get it, but that you're going to be the one to give it to them, and then cause poor outcomes. So this is what a lot of people are feeling right now, and you may be relating to this. So what we're going to do is we're going to tap on some of these fears. If you do have questions about tapping the basics of it, please go back to the first video because I go through all that in there, and I want to get right to the tapping. So we're going to start off, first off, every single time we tap, we want to have a piece of paper nearby with a pen. So we're going to jot down the emotion we're feeling, which we know at this point is going to be panic and anxiety about the actual sickness itself, getting yourself sick or other people. And we want to write down how strong that emotion is within our body right now. So is that a 4? Is it a 6? Is it a 10? How strongly are you feeling that panic and anxiety? And write that down. We're gonna recheck on that as we go through. And if you can, not mandatory, but if you can note where you feel that in your body, please do so. Maybe you feel panic in your chest, or there's a butterflies in your stomach, or weighing on your shoulders or in your neck, something like that. You can write that down as well, or just take note of that. We're going to get started. All right. Even though I am anxious that I am at high risk of getting infected and passing it on to my loved ones, I love and accept myself. And now you'll repeat back. Even though I'm anxious that I'm at much higher risk for getting this virus and for spreading it to my friends and family. Go ahead and repeat that. I accept and forgive myself exactly as I am in this moment. Even though I have anxiety that I'm going to get sick with coronavirus and that it's going to not just affect me, but my family and colleagues as well. I love and accept myself completely. And I know that I'm doing everything I can do in each moment, which sometimes just means getting through the day. Top of the head. And I'm not going to say each body part as we go. I'm just going to do it and you can move with me. I'm anxious. So much anxiety. I'm afraid of getting sick. And remember also here, don't repeat something if it doesn't quite resonate with you. If you're not afraid of getting sick, but you're more afraid of other people getting sick, your family members, or getting them sick, just substitute it in, because not everything I say is going to resonate with every single person. So don't repeat something if it doesn't resonate. Figure out what does and say that instead. All this anxiety. I have a lot of worries about my health and the health of my loved ones. What if I get sick and I pass it to my children? What if I get sick and I pass it to my in laws or my parents? What if my spouse gets sick and is no longer able to take care of our kids during the day when I'm at work? I'm anxious. I'm so anxious. All this worry and fear. Sometimes I even feel panicked. I feel like I'm waiting on bated breath at every moment. I'm scared for my patients, for my family, and for myself. I'm scared for my elderly patients and the high risk that they're in. I think I'll be fine if I get infected, but what if I'm not? What if I infect my family members? What if I get sick and I can't go to work? I'm anxious that I've passed it on to my patients without even knowing it, or that I could pass it on to my patients without even knowing it. I am afraid that my parents are going to get sick and won't recover. All this anxiety, so many unknowns. I know that you're supposed to be at less risk if you're under 60, but I know there are some doctors who and other people who have still gotten sick. How can I know for sure that I won't get sick? I'm so anxious. I have all this anxiety and it's intruding with my day to day thoughts. Feels like all I can think about. I'm playing every scenario over and over again in my head. And that just makes my anxiety feel worse. I'm anxious that I might make my family or my patients sick. I'm anxious that I won't be able to protect myself at work from getting sick. All this anxiety. All right, so let's pause. We're going to take a deep breath. All right, so now we've taken a deep breath. Let's check in. Did any aha moments come up? Any memories, visions, images, aha moments, new emotions? Anything coming up while you're tapping is really important. Take note of that. It's your subconscious sending you a message. And if you have a very strong new emotion, you may want to start tapping on that instead. So now check in with your severity level of your anxiety. and see if it's gone down, if it's gone up, or if it's stayed the same. And if it's gone up or stayed the same, ask yourself if there's another component to this that you're missing. If um, maybe it's not just anxiety about the fear of getting sick or of your loved ones getting sick, but maybe there's some other components of anxiety, or maybe it's an entirely different emotion, and that's okay too. I'm doing this based on the results that I got from my surveys of doctors and as what I chose to do for the first day, but that may not be exactly what you're feeling right now, and that's okay too. So now that we've taken a little break, we're going to go back in again. Top of the head. I'm feeling anxious. So much anxiety. I have so much fear about my health and the health of the people that I love. I'm afraid I'm going to get sick. I'm afraid I'm going to be one of those doctors under 60 that gets sick. I'm afraid that I'm going to pass the illness on along to people in my life who are much more vulnerable. I'm afraid that I'm going to infect my family. Who's going to take care of my family if my significant other gets sick? Well, I'm at work all day. All this anxiety. I'm feeling lots and lots of anxiety. I feel so out of control. I'm afraid what's going to happen to my elderly patients since I'm not visiting them anymore. I'm afraid for my friends from residency and med school who are in higher risk specialties than I am. I'm afraid of what's going to happen if I have to get hospitalized. I don't know how I'm going to take care of my family as a single parent if I get sick. All this anxiety. I feel worry and I feel fear. I feel so panicked. I'm anxious. I'm concerned that I'm going to get sick and not be able to provide for my family. I'm afraid that I'm not going to be able to do enough to help. I'm afraid that I'm going to pass the disease, the virus on to my family or parents or friends without realizing it. All this anxiety. I feel so much anxiety. Okay, stop, take a deep breath in and out. So we're going to ask ourselves if any aha moments came up, any new emotions, memories, images. Maybe you've been involved in other diseases similar, like SARS or swine flu, and have some bad memories there. Maybe some of that stuff is coming up. Maybe there's some issues with your family. If you had some fights or a bad relationship with your parents, and now you're sort of feeling some emotions about that. Lots of stuff can come up here. Maybe you're realizing it's not anxiety anymore, but it could be anger or resentment or frustration. Take a note of that, and also check in. How strong is your anxiety? If the anxiety is still a 4, 5, 6 or higher, rewind this recording and keep tapping through those same tapping points I just did. And if there's any other nuances to it that I didn't get that are particular to you, then please throw those in as well. But for now, if you're at a 0, 1, or 2, or maybe even a 3, we're going to move on to tap in the positive. And if you're not ready for the positive, just again, rewind and listen to the beginning part of this video until you're at a 0, 1, or 2, or maybe even a 3. Now we're going to tap in the positive. I have anxiety about the unknown in terms of my health. But I know that I'm doing everything I can to protect myself and my family. I know that we've had some extra time to prepare for this disease, and we can see what's worked and what hasn't worked in China and in Europe and in other countries where there have been outbreaks. I'm a highly trained medical professional. And even though I don't have all the answers, I know that we're all doing the best we can. I worry about the well being of myself and my family and my colleagues. But I also know that I don't have to make all those decisions for them. I'm not in charge of this entire epidemic. And I can keep doing what I can do to educate the people that I love. And I can practice good hand hygiene and social distancing. And I can do my best to make sure that I'm following best medical practices. I feel that anxiety and fear leaving my body. I'm so grateful to have more mental space to live my life and make the right decisions in each moment. All that anxiety leaving my body. I feel so much lighter. I know that obsessing about it isn't really going to help. Maybe I'll limit my exposure to the 24-hour news cycle. I'm going to use this time to really connect with my family and do repair some relationships that might need repairing. I might even be grateful to have this chance to slow down and really reprioritize. I have this chance to connect with the people in my life in a really meaningful way. And I'm going to do everything I can do to maintain my own safety and that of my family and colleagues. Feeling the anxiety leaving my body. And I'm feeling so much lighter. Okay, now we'll pause, take a deep breath in and out. All right, so make a note of how strong your anxiety is right now. If any other aha moments came up, or thoughts or ideas of stuff you want to do, committees you want to get involved in, people you want to call to tell them you love them, whatever it is that you want to do, I think that's, if it's coming up for you now, it's important, and make a note of it. Tomorrow, we're going to talk about anxiety, fear, and panic in terms of the logistics, excuse me, of the logistics of this epidemic, this pandemic. And if you have any questions, please reply to the email. I'm happy to support you. Again, this is not a substitute for mental health care, but this is designed to help you manage some of the stress and the unknown. And if there's anything I can do to help you, just reach out. If you do want to work together one-to-one with tapping, that is a great tool to help manage stress, and I can really, really get in there with you and help you to process some of these emotions. Also, meditation is a really, really, really great tool right now, and I have an online meditation course that is CME-accredited for not just doctors, but for nurses, PT, OT, social work, dietitian, PAs, and NPs. So if you are in any of those professions, not just doctors, please know that your mental health is very important to me and to lots of people, and we know how important you are. And please reach out if you need anything. Thank you so much, and I'll see you tomorrow.